Perfect. Well, it is 7 o'clock. We are going to get started here. So welcome
PTA.
everyone. Yay. Welcome everyone. My name is Dr. Emma Shapiro. I'm a physical therapist and healthcare entrepreneur. And I am here with Kim Nartker, and she is a PTA. She is a boss though, because she has started Stretch Physical Therapy, which is her own practice as a physical therapy assistant. She's breaking boundaries. And so this is what this webinar is about, is how teaching you as an assistant, whether you're a PT assistant, an OT assistant, personal trainer, ATC, exercise physiologist, how you can break the boundaries and start your own therapy or wellness business. Hey, Kim, thank you so much for joining me.
Oh, thank you so much for inviting me. Again, it's a pleasure to be here, and excited to get this information out to people so that they can avoid the pitfalls that I unfortunately had to go through to get to where I am.
Definitely. Well, we exactly. This webinar is all about saving you time, stress, and lots of money as you try to start your own therapy or wellness business. So I think, Kim, let's get to know each other a little bit. And why don't you just sort of share your story as to how you got started trying to start your own business?
Absolutely. So I was in the field for probably about 12 or 13 years. As a PTA, I was passionate. So when I started school, and I started a little bit later, I did nothing but eat, sleep, and drink physical therapy. I was just, it's just totally my passion throughout my career. My mom, who is in Georgia, because I am from Georgia, actually had lumbar stenosis. And that's one of the most common diagnoses that most of us see. And she had lumbar stenosis, but she was given that most common exercise sheet that had flexion exercises and extension exercises. And yes, it's still going around with the doctors. And she really didn't get any help with it. She said, these exercises don't do anything for me. She'd gone from one doctor to it. Let's see, she'd gone from a cardiologist to her primary care doctor. She had a high stress job. She was overweight. She really didn't know anything about exercise because she wasn't raised around that. So she was trying everything she could to listen to everyone to get the correct advice. And she was seeing personal trainers. She went to Curves. She was going back and forth to the doctor. She had tried every diet on earth that she had ever been introduced to. And in 2013, she said, I'm done with all of this. I'm done with the diet. I'm done going back and forth to people who really don't help me understand what's going on. I'm not losing weight. I'm doing everything that everybody says, but no one speaks the same language. So my cardiologist says that I need to do this. My primary health care doctor says I need to do this. My personal trainer says this. Curves says something different. When I go to the gym, I'm not supposed to do this. I don't know if I should do the treadmill or if I should do free weights. It was just really confusing. And unfortunately, my mom passed away a year later. And my last conversation with her, she was very, very, very frustrated. And she smarted in saying, I'm not only done with this, I'm done with asking questions because nothing is helping me. And I'm just going to be happy with who I am. And unfortunately, I never spoke with her again. And in that conversation, she said, you're in this stupid healthcare system. Why can't you do something about this? And she didn't mean anything literal by that at all, but that resonated with me for many years. And as a PTA, I kept hearing PTs, my patients, tell me that I was different and that I was looking at things differently than a typical therapist would look at. And I thought it was just them being kind. I was naive and said, well, that's very sweet of you. Thank you. But that continued for about 10 or 12 years. And when I got to Ohio, my patients, I would see them out in the community and they say, your therapy was the only therapy that helped me. When you sent me to the orthopedic center, I really didn't get any help. And I thought, there's no way. There's no way that PTs are not helping our people because we're all good. PTs, CODAs, and I'm talking everybody. So I don't know which story resonated the most, but someone said the same thing for one final time. And I thought, I need to get on the phone. I need to see in our area, because I had only been in the area a couple of years, so I really didn't know enough about anything. So I got on the phone with any PT that would talk to me. And I asked the same question. And I said, in our area, what diagnosis do we do kind of well, but really, if you're being honest with me, we're not justifiably helping the consumer with? And every person that I spoke to said back pain and sciatica. So sat on that for a little bit longer, studied and learned more about back pain and sciatica, because I was by far not where I am right now in that area. Finally told my husband that I felt a calling to open a clinic, because I just felt like everybody was saying the same thing. And it was confirmed by some of the market research over and above the phone calls that I did, that our area really needed someone to focus on back pain and sciatica. And the reason for the wellness for me was my mom. It was totally that last conversation of, well, you're in this healthcare field, why can't you do something about it? So back pain and sciatica blew up for me. I started with Chad Madden, his marketing secrets, probably 6 to 8 months after I opened my clinic, grew 300% in 6 months. Was overwhelmed by the success of the clinic and the amount of patients we had, and I was in network. By the end of that year, saw my bottom line be absolutely nothing, because although we were busy and there was not an open slot on the schedule, it was not profitable. So re-looked at things and prayed about it and thought, okay, there's got to be something more. And then decided, hey, this is not what I went into business for. I went in to truly help people. And I don't want to be a mill like everybody else around me. I really want to be an experience and be a trusted resource for my community. And I can't do that through in-network. So broke into the out-of-network realm. Been doing that for, well, June will be 2 years. And then since then have taken out Medicare 100%. So we are cash-based. And the funny thing about that, when I took out Medicare, and that was my biggest fear, was, oh my God, am I going to be able to keep the doors open if I'm not, seeing everybody? How do I answer the question when they say, do you take my insurance? But when I did that, I started noticing when I pulled, we have a drawer and we have so many different wellness programs that we have cards that separate the type of clientele we see. And I opened it up one day because I knew at the end of each year, if reimbursement was down, it was down because I had too many Medicare patients on and I didn't have any third-party payers. Well, I opened up the drawer and I had nothing but wellness cards. And I thought, well, this probably isn't normal. And my entire drawer is nothing but different categories of wellness things. So it's been this wonderful, enlightening experience of how we are truly helping a consumer in the way that I wanted to start this business as. We are actually delivering in that. And consumers eat it up. They just love it. They feel welcomed, and their comments are, I feel like I have hope again.
Well, see, that's why I really wanted you to come on here, because I know that a lot of people want to start a similar type of business, but they don't want it to be a mill. And I don't know who knows nothing about insurance, like how, if I were a business, like how I would choose what insurance to bill and all of that. Like, go ahead in the chat. You can put it. I will tell you, I have no idea. They didn't tell me about any of this in school, how to run a business. And so I think you're telling us about all these things where, as a business owner, you really had to learn so much on your own, and it was a great challenge. Exactly. Yeah. Right, Angie? So maybe
absolutely
break it down to, like, I think the first question I got from a lot of the people on this webinar and in Facebook was, how did you break the barrier of a PTA going into starting your own practice? Like, what was your thought process, and how did you deal with all the license questions? And could you go into a little bit of detail about that? Because I think a lot of people are saying, I want to do this, but I'm confused about my license.
Absolutely. So I knew that a PTA could open a private practice when I was in school. So I went to school in Hawaii, and my program director, actually, one of her lectures was, it wasn't the whole lecture. She just, I think, threw it out there, and it resonated with me. But she said that a PTA can own a practice. You just need to understand in your state, if your state allows for someone besides a PT to actually open a private practice. So the first thing that you have to do is find out if your state allows for someone besides a PT to open a PT practice. And fortunately for me, Ohio was a state that did allow it.
Okay. Do you know if most states allow that or not?
And from what I've seen, I don't know all of the laws. I haven't looked around at all of the states. I think New York, you can't. But there are wellness things that you could do. So don't cross that off yet, okay? Because we're going to be talking about wellness, and every bit of this pertains to you owning a clinic. But I think New York City is one of those that you can't. I would have to get a confirmation on that, and I'm happy to look into that a little bit more. But a cheap way of doing that is just to post something in one of the groups. As a PTA, is there anyone in my state that knows if a PTA can own a business? That's going to be your very, very first hurdle. And finding that out is going to be the most important thing. But it will not decide whether you can not open a wellness center that has nothing to do with PT and still be very successful in doing what you're doing every day. You just don't call it PT.
Got it. So that's really a great segue. So I know that you have so much information you want to share on brick and mortar, the wellness as well, and a solo practice. Why don't we segue first into wellness? Because I know a lot of you voiced that you really wanted to hear more about the wellness side. So seeking ideas for combining health promotion with CODA license. Ooh, I like that.
That's wonderful. Absolutely. So brick and mortar, that's what I have, is a brick and mortar facility. You have to get into, there's a lot of things that we have to do first, okay, before you open a brick and mortar. But brick and mortar and the pros and cons is you're setting up a community foundation, a place that people can come and you be that trusted resource. You could choose to be in network or out of network in one of those facilities, and you choose to partner with people in the community, meaning your chiropractors, personal trainers, massage therapists, things like that. So those facilities are really going to set you up in your neighborhood to be the trusted resource for whatever care you're delivering. So I'd love to hear some ideas that you all have, because I'm happy to share what you could do with that. My passion, again, was healthy living as you age. So it's really navigating how you're aging and how that makes changes in your body. So in my brick and mortar, we see anyone from a 10-year-old up. My oldest is a 95-year-old veteran. And everyone's single thing that they're coming in for is mobility. So people want to stay and move well. And they don't care if physical therapy does that for them or something else does that for them. So you can do a brick and mortar and truly run a successful practice that can be a PT practice, or it can be a wellness practice. When we're talking about virtual, the cool thing about virtual, now I'm going to tag Rob Binding here, because of course he is the guru in all of the telehealth stuff when you're wanting to look into the insurance component of coverage for those services. So I'm talking about virtual, what you could do with your current level of experience to help people move better and stay moving better. So virtually, you can offer services based on your education, not based on your license. So that kind of segues into the wellness, which is that question that most people ask out there with wellness and licensure. In the state of Ohio, you need to make sure that when you treat a customer for something that is in the wellness spectrum, that you don't say, I am a PTA treating you. So for example, if I'm a PTA and working as a PTA in an outpatient clinic, then I use my credentials. If I come to you and I do something that's wellness, and maybe I'm going to do some stretching or something that just doesn't follow into that same category, then you just don't mention your PTA credentials. You can mention that you graduated as a physical therapist assistant, but you are providing wellness services not under your licensure. The other thing you need to look at with that is your state. Some states have wellness organizations. State of Ohio does not. So we do not have clear wellness guidelines that we have to follow. It just follows under one big platform of wellness. So you don't have to have a license or a personal training certification or anything like that to offer wellness services. You can actually go out and get a, what is it called? A weekend, being a pastor. What is that online? It's, I can't think of what it is.
Yeah, yeah.
But I think it's cost $60, and
yeah, it's like
you can do that and do anything you want to do.
You can be a personal trainer. Exactly. Now,
yeah, I'm talking about. No, I'm talking about getting a certificate to be someone
like
who
getordained.com.
like does weddings.
Yeah, getordained.com or something like that.
So if you do that, you can actually perform anything wellness or not wellness completely legally in the state of Ohio.
Wow. Okay. Look out for those ministers then. Who knew they were so fit? Now, when you're talking about these rules, I know some of people are probably going, okay, I want to look this up, but where do I go to look this up? So is there a specific like a resource that we look at for this, or what would you recommend?
So you want to go to your state practice acts first, and you want to look under wellness to see most practice acts, I would think, have looked in there as far as what their guidelines are for wellness. State of Ohio makes it very clear that, and I call them too, pick up the phone and call them and ask as many questions as you can. But again, under state of Ohio, it was, you can do anything you want to, as long as when you call it wellness, you don't say I'm a PTA.
Gotcha. Yeah, that makes complete sense. So for those of you who want to look into this, just check your practice act. And like what Kim said, if you have any questions, it's always best to call or email directly. That way you can get the best advice possible, because we want to maintain your license. We don't want to have any sort of restrictions there. And now
absolutely. And then you do need to check wellness too. So in your state, you need to see what the wellness guidelines, and see if there is a foundation or any organization that has a structured wellness, because they may have guidelines that you have to follow. So those two things.
Gotcha. So basically the first step, if we're thinking about brick and mortar or wellness, would be basically looking at our state laws and our guidelines, making sure that we know how to practice within our PTA, CODA, exercise physiologist rules and guidelines. So then how did you decide upon the next step, which was creating your brick and mortar? Why choose that maybe versus a virtual? Because I know the hot trending right now is virtual, but you seem to be having really good success with the brick and mortar.
Something called me to brick and mortar. I don't know. And that was 7 years ago. So actually it was 8 years ago that I started and went through the process of what do I want to do, writing my vision, my mission. And it's cool because even 7 years later, now that I've been in practice, I'm actually doing exactly what I knew my vision was then. So, you're on the right path and you keep forging on in the right direction. So basically brick and mortar was just where I felt like I was going. Now, knowing what I know, I think that expanding out into virtual is the way to go, because all consumers, their primary problem in getting to physical therapy and staying and keeping themselves in shape is time. And because of that time, it's not even the finances. My rates are very high. It's actually, my rates are highest in our area. I don't think a PT clinic charges anywhere near what I charge in the area. And I don't have problems getting patients with that to pay that. But your challenge is people's schedules. I mean, they work for so many hours and you can't keep your brick and mortar open from 9 a.m. to 9 p.m. as a private practice. You really have to cut down those hours, and it does limit, who you could see. So virtual is going to be a great way to get your name out, and you can go cross state lines with, being able to help people.
Definitely. I think a lot of people My biggest fear, and everyone, I'd love for you to put your biggest fear in question, because perhaps we can ask that today with Kim. And everyone, I'm so glad you're still staying on. We're going to be continuing to provide lots of great content. And we've got some really awesome surprises near the end of the hour. So please keep staying on if you can. But I think my biggest fear is starting something and not having any clients. And so how did you go about figuring out that you would have clients and get clients? I know that's a very long
I want to tell you that so it's very challenging. And so we're going to be going through this specifically in the course, some of the challenges and what you can do. And I've got some book resources and things like that. But I have to say, I was so excited. I got everything done that I was supposed to get done. And then I opened the doors, and my first patient was actually a nurse that I had been working with. I was doing home health visits at the time. So I did my home health visits and then came in and did everything with the business. And from hers, I got word of mouth referrals. And I want to be honest, until I started Chad's course and actually did some marketing, it was slow. So you have to understand what type of practice, and we go into this in the course, what type of practice you want to open with, whether it's going to be an in-network and out-of-network. There are plenty of things we're going to go over step by step in the course, but that's one of the biggest things you need to do, because I went the in-network way, and I was busy, like crazy busy, but busier than I wanted to be. So I'm doing more of what I need to do now. I would say in the beginning, until I did marketing, it was just slow. But I had an innate ability to collaborate, because I feel like that, again, in my practice, I am helping you along your journey, wherever you are, to keep mobile. That's the role that I play. So I'm not the only role in a person's life. I feel like chiropractors play a role, personal trainers play a role, holistic services play a role, your doctor plays a role. So I went out and met everyone that I could through networking that would collaborate with me, and know that there were ones out there that wouldn't. They stole patients. They said, oh, whatever she does, I do the same thing. I mean, you're going to have those people. But if you really look for people who are collaborative and love what you're doing, and you make it different, those people are going to stick with you. So I still get referrals from some of the first people that I met. One was a registered nutrition consultant. Another is a local personal trainer that were very highly involved in the community. I still to this day get referrals from them. I collaborate with chiropractors. My brick and mortar model is very, very much run like a chiropractic type clinic. And when I say that, I mean, as far as what they know is and how to listen to a customer. So I meet the customer's needs. And every single visit that I saw, I had a piece of paper in my pocket and a pen, and I would ask, what brought you in? What do I provide that helps you? What do I provide that doesn't help you? What can I add that would make you better? What can I say to help bring other people in? And I kept just a little thing like this, and I wrote in there every single day for a year, and everybody said the same thing. Everybody said that when I came to you, I feel like I have hope. So that's just one of those things. I changed the colors in my clinic, everything to resonate with that customer that had been through the healthcare system, that had the same frustration that my mom had, and trying to create my brick and mortar that made sure that didn't happen. So no matter what, when they ask a question, we're there for them. And maybe it can't be through me because I have another client, but we get those questions answered, and we let them know that, we're there from you, and we're not going to discharge you and just say, okay, goodbye. We're getting you to the next step, whether that's to a chiropractor or to a personal trainer or to a gym, whatever that is. And those are the people I collaborated with. And that's why I have the referrals that I have.
I think that speaks one volume to you as a person, but also just a really savvy business. We can't be our own island. We have to work together, and you're going to get referrals from all those sources, just like you're giving them referrals. So we have some really great questions in the chat here. We'll start with Yara's and work up. So she says, Kim, wonderful info so far. I've had my own gym for 7 years. So for me, there's not a huge fear. I'm just wanting to make sure I'm following proper guidelines. And so what do you think of like, if someone were to own their own gym, what would be like a smart transition for them? I think just starting, probably continuing into the brick and mortar. They're like a perfect segue.
Yeah, I don't know. So if you're in a gym and you're comfortable and you've got a full caseload, that's what I would look at. Is your caseload full? If your caseload is not full and you're looking to build a caseload and you have to be in 2 different locations, you have to consider the cost. And if that added cost is going to produce a return on investment that's going to be beneficial, because the worst thing you can do is open in 5 different places and then scatter yourself, only to know that you're not going to be able to sustain that. So I would say if you're full, and Yara, your next one, do you have employees? Absolutely. Yes, I have employees. If you're full at your gym and you know that you're at capacity, and we go over that in the class, how many people does it take? What is your capacity? How does scheduling look? Oh, you closed it. Okay. I got you. I'm sorry. Well, when it comes to deciding whether you want a brick and mortar or not a brick and mortar, and you are in a location like a gym, again, if you're totally full, then I would look at expanding that business and looking at what's going to be the best return on investment, whether that's another brick and mortar so that you can reach out to other areas that you can do the same thing. And that's in the course too, how you do that.
Awesome. And I think a couple of you have mentioned that brick and mortar and virtual, I think they go hand in hand. I think if you want to start a brick and mortar and then build into virtual, I think that is perfect because you already have a streamline of patients that maybe just need a virtual checkup every so often. And then for the reverse, if you want to go virtual is great because for someone like me, I'm not really ready to full on, buy a clinic and buy a treadmill and all these different things. I can start virtual and then build caseload as well. And then eventually build that out into a brick and mortar. So I definitely think both points have their own pros and cons and can work, pretty seamlessly together. Yeah, exactly. Perfect. Well, let's see. Where were we at, Kim? You were talking a lot about wellness. Go for it. Any points you want to have?
Oh, no, I was just seeing if there were other questions as far as there. Wellness is the broadest topic ever. And I tell you, really understanding what wellness means is where you're going to want to start with that. Okay. So in my area, people's, when I asked them what wellness meant to them, wellness was really mobility, and how to live and be able to do the things that they wanted to do, like pick up their grandchildren, get up off the floor, walk around Kings Island, walk around the grocery store, play golf, run. And I do have some guys that do triathlons. I have many, many different levels. It's really understanding what your consumer thinks wellness is. And again, mine is mobility, and mobility is just that buzzword. So I use that word to my advantage and offer mobility assessments, and people are constantly going, oh my God, yeah, I want one of those. The other thing that I offer is stretching, and those are all just your lead magnets to get people in the door. So if you figure out what a consumer is saying, and most of them say they're tight, if you Googled stretching right now or tightness or something like that, I want to say it's 5 million people searching on Google for tips every 5 minutes.
Wow. We're going to write that article later.
How can yes. So, I mean, seriously, your community is looking for remedies to tightness. And we in the healthcare field can help people with tightness every day. And as a physical therapist or a physical therapist assistant or a CODA, stretching is one of the first things you can do. And assisted stretching, if we don't jump on it as a profession, you already have Stretch U. I'm trying to think of the other company that does stretching.
Yeah,
Massage
it's like
Envy is starting to.
Flexology or something like that, or Strexology. Yeah, there's another one there's a lot of these stretching businesses coming out there.
Yep.
Yeah.
So yeah, because they've learned that that's what the consumer wants. So they're mixing massage therapy and then stretch because that's what a consumer wants. The benefit that we have is that in my clinic, I know that I use 4 or 5 different techniques to gain mobility in the body. So my stretching has evolved, and that's going to be another course that we're going to be doing, is teaching you guys how to do that. But your basic knowledge of stretching right now is enough to, when someone says they're tight, to just say, hey, can I do a couple of things to see if I can help you with your tightness? And if you can, boom.
Yeah.
Client.
Now, I think going back a little bit now to your assistant, did you find any difficulties as a PTA? Like, what were some of your biggest challenges starting your business and even growing your business?
One was insurance, and you have to have a bigger practice when you're taking in-network insurance, because your business side is going to have to be almost equal to your clinical side. So to me, it just wasn't something that I wanted to do, but you need to know that there are going to be so many things that someone has to do with insurance and denials and authorizations and all of that stuff, because your consumer doesn't understand it. That's a lot of work that you have to do. And so you're going to be the one that has to train your employees. I would have to say my biggest struggle would have been hiring the right people to service a facility that is my passion, because people are not me. So the passion that I had was not their passion. So for me to come to them and give them ideas when it wasn't something that they wanted to do was the biggest struggle. So I didn't grow the way that I would have loved to have grown, because I had to put so much money into hiring and training, that spiraling circle of hiring and training and letting go of employees, because they just weren't the right people and didn't understand nor follow or buy into what my mission and vision were.
Yeah, that makes sense. I think it almost it's really hard to find those employees to help you scale your business. The business side, I think we're all amazing therapists, but I feel like why we're on this webinar and why we sometimes don't take that leap is the business side. We don't know how to put everything together to launch the business rules and regulations, the insurance rules and regulations, and navigating all of that. Angie asked about rural communities. What's your experience with any rural communities in Ohio? Have any sort of patients from a rural area used your services?
So we have right now the furthest patient that has come to see me. She drives 2.5 hours to come see me from Indiana. I've had people come from Columbus, from way above Dayton. So 2.5 hours is the highest. On average, I've had people come an hour out of the way. People come from Kentucky. Again, if you offer a product or service that can't be offered to someone and they see value in it, a hurdle is not distance. Distance has never been a problem for patients once they see the value in what we provide.
Gotcha. And Angie asks, what about insurance? About how many hours do you normally delegate to insurance processing tasks?
That depends on your types of insurance. So the 5 or 6 that we took when we were in network Medicare, that's probably your most challenging one. Then when you go into your third-party payers, your Anthem, which is also your Blue Cross Blue Shield, your Medical Mutual, your Cigna, your Aetna, those plans really are not very hard at all. So those are your easier ones to work with. But your hurdles come in the denials, and maybe your computer system didn't put a modifier on. So it comes in on that side. So I would say what benefited me the most from the beginning, and I'm glad I did it, is I outsourced my billing from the beginning. I have a local chiropractor that offered up a girl that was doing his billing, and she does it out of her home for multiple practices, and so she has just been a godsend. That's not something you want to put your time into.
Yeah.
You just don't. There's so many other hats that you have to handle that's just not one of them.
Yeah. Yeah. And there's one of your answers to one of your questions too, Angie, about who would you hire out? Definitely billing is especially one of them. And so navigating your PTA role and insurance, did you have to find a PT to always sign off? How did that work?
Oh, yeah.
And
yeah,
did you
absolutely.
hire them as a full-time employee, or were they contracts coming in to sign off? How did that work?
They're employees.
Okay.
Yeah, employees. Currently, the one that I have owns her own practice. She's been with me for about 4.5 years, and she ventured off to do her own practice. So now she's just coming in PRN and doing the evaluations. The way I have it set up in my clinic now is the evaluating therapist sets up the plan of care. And in the state of Ohio, except for Medicare, because Medicare has federal guidelines that you have to follow. Okay, I'm talking third-party payers. But in the state of Ohio, PTs need to be available by phone. So she's available by phone, and we've known each other, like I said, for 4.5 years. So I trust and know her evaluation skills. I'm looking for another PT in hopes of having her do specific tasks, her or him. But right now, where I am, I only need a part-time physical therapist.
Gotcha. That makes sense. Kim, we're sort of starting to near towards the end. Is there any big things you want to share before we sort of go into our next segue?
We kind of talked about virtual. We talked about wellness a little bit. We go into many different wellness things, so that may be a course on its own, because that I think that's the one that's the scariest and that's most misunderstood. But there are so many offerings that you can provide to someone. I'm happy to help if you have any questions or anything, but our maintenance programs are based on how much we achieve in their treatment, whether it was physical therapy or if they just came in as a wellness client. And the maintenance programs are programs that build and progress them to the next level.
Okay, gotcha. One last question here, and then we have something super special to share with you guys. Angie asked, Kim, do you have to make sure that like you're complying with supervision visits? What do you do to make sure that you're complying with those supervision visits?
Oh, absolutely. So it's based on the plan of care. So again, Medicare is a totally different ballgame. So you have to understand federal guidelines and follow those federal guidelines. So when we took Medicare, it's one-on-one. Therapists had to be on site, and we had physical therapists that were full-time. They were on site that did that. So I've had PTs, PTAs, exercise science, and we practice as a team model. So yes, you have to follow supervision requirements. You have to do what your laws say for your evaluation, your reevaluation based on what your policies in the clinic are, and based on your discharge standards, because PTAs cannot do any of those. And just because of the trust I have with the PTA I've had and known for so long, she already knows how I treat. We've treated together while she was working with me. So she trusts the care that I provide. And as a PTA, know that it's very important that you have a PTA that trusts your care. And if she doesn't, she's not the right PT. She or he is not the right PT for you. Because I, as a PTA, if I feel like it's over my ability or knowledge base, I'm not going to see them. I'm not going to see that patient. There is a PT-PTA relationship, and you are the PTA. So you have to follow the role of being a PTA.
Yeah. Is it ever challenging for you to be the role of PTA and feel that limitation, between a PT and a PTA? Are you ever like, I wish I had the PT hat on?
You mean as far as if I should have gone and become a PT?
Yes, but that's a long question. Saying? I diverge.
I did. That was one that I didn't say that in my story. So I really aspired to be a PT. I really did aspire to be a PT. But by the time I opened the clinic, I was already in my 40s. My kids were grown. I was newly married. It just wasn't in what I was going to do at my age. Not that I couldn't, don't get me wrong, because I was pushed to be a PT. I just felt like my calling was more in, owning a clinic, and I knew I could. So I went that route.
Gotcha. And I know, I'm sorry, OTs and CODAs, I know we've talked a little bit more about PT, but Kim, can you just reassure some of the CODAs and OTs here that a lot of the stuff we've talked about is very relevant for them, and you can basically follow the same sort of guidelines and procedures and so forth?
So any discipline, just to say, so it could be a CODA, it could be a PTA, it could be a PT, it could be an OT, it could be a speech therapist. You could also be an exercise physiologist, a personal trainer, a wellness coach, a health coach. Any of those disciplines are going to be able to walk through this process. When I started my practice, I had that checklist that the APTA had, which I went through it, and I had it printed out, and it was on my desk, and I checked through everything, and I thought, oh my God, this is nothing. I still have so many more questions. So this course is really going to be, I think we're going to have too much information, Emma, because of everything that is in there. But this is literally to help you avoid pitfalls in every area from start to finish. You should have opened a practice by the time you finish this course and be set up and successful with the ability to have leads already coming in.
Yes.
Okay. So, it's going to be a step-by-step walk you through guide, and any other questions that you have, I'll be able to do some coaching with you as well.
Yeah. So everyone, I think Kim could continue to share so much information about how to be a therapy owner, a wellness owner. And so it's really a challenge to share all the information. And so Kim has sort of spoken a couple times about her course. And so we wanted to take a couple minutes at the end here to share with you Kim's course in case you are interested in taking the leap. Obviously, you can tell that Kim is very well versed in running a business, in growing and scaling a business, and being really successful. And so she has created a course, and I will share my screen really quickly to share basically all the things that come with the course in case you are interested. So hopefully, let me see. Kim, can you see that? I'm sharing my screen. Do you see the webpage?
Mm-hmm.
Awesome. So for everyone on here, we appreciate your time. And so Kim has created a very special offer for you on this webinar for her course. And trust me, I wouldn't be just sharing just anything. This is really a rare course in the fact that this is a complete course from start to finish for all answering everything. It answers the business questions you have. Kim has really created a formula and a model to help you start your virtual, your solo, or your brick and mortar practice, especially as a PTA or a CODA. But in addition, you could totally do this if you're a PT, an OT, an ATC, exercise physiologist, personal trainer. And so it really is a proven model because she's so successful. And so I'm going to continue to share with you all the things in the course, but if you do sign up, the first 20 people will get an extra $50 off this course. This course is $697. With the $50, it becomes $647. But I'm going to tell you, there are very few courses out here that teach you how to start your own virtual brick and mortar and solo practice all in one course. And there's none that teach you as a PTA or a CODA. And this is just an extremely low offer because I have seen some therapy courses offered that are in the thousands of dollars. And so really, I can tell you that it may seem expensive, but this is an extremely amazing offer. And so Kim is going to teach you how to start your own brick and mortar practice, your own virtual wellness practice, and your own wellness practice if you just want to do the wellness side in addition or outside of the therapy. And Kim has 20 years of experience, 5 years of ownership experience, and she gets 80% conversion for her PT and OT workshops. And so you're going to learn in this course how to be a conversion master and just get clients like, dude, they're just going to fall from the sky. But here's the course. Basically, I'll walk through the outline for you. And if you have any questions, please post in the chat. But basically, we're going to teach this course live because we know that you're going to have a lot of questions. And I've taken courses, and during the course, I'm like, I have all these questions and I never get answers. And I really am not feeling accountable. And so this course is live. Now, obviously, if you can't attend, don't worry, everything is recorded. You'll have all the replays. If you don't feel like you can start a practice now, even a virtual practice now, it's okay. You can get the course for life. And so if things come up, you can always watch the course later. But we'll be live teaching you in 10 sessions. And if it takes more than 10 sessions, we're happy to do more sessions to make sure that you, at the end of this course, launch your virtual or brick and mortar practice. But in session 1, we're going to be coming up with basically the mindset for owning a business. And then session 2 and 3 is answering all of your business questions. So all the questions about picking your name, your mission, salaries, forms, tax IDs, those regulations, how to search for all of that, making confident that you're choosing between an LLC or a sole proprietor, all those things we're going to talk about in sessions 2 through 3. 4 will be staffing and equipment. Now, obviously, if we run a little bit behind, we'll move things in different sessions as well. But we're going to be talking about hiring. As you could tell, Kim has really learned the good and the bad about hiring, who to hire, and how to, go about all of that. I mean, this is a complete course for running your business, and it's telling you every single thing. So even if you only want to do your virtual now, this is great because you have the virtual and the brick and mortar all in one course. So later you can come back to this and see how to start your own brick and mortar once you have enough clients. She goes over marketing, which is huge. So we really want you to be successful and find clients right away. So we go over marketing, including public speaking, creating a referral system, creating those connections she talked about, social media, print and magazine advertisement. Little surprise here, Kim is actually amazingly successful with print and magazine advertisements versus Facebook ads. And we'll tell you all about that in the course. Calls, converting calls. How do you go about a call to actually get someone to become a patient or a client? All the different forms you have to have, your intake form, license and liability form, consent to treat. And basically then session 9 and 10 will be sort of like wrapping up, asking and answering any questions, more tips and tricks, basically learning the ins and outs. Basically in 10 sessions, you're going to learn what Kim had to suffer through for over 5 years. Right, Kim?
Right.
And so in addition to that, not only will you get the live sessions and all the recordings for life, but you'll get her Conversion Master Workshop bonus, which is basically how she does these workshops where she gets patients actually in the door and converts about 80% of the time, which is amazing. You'll get membership into a private Facebook group where Kim will continue to ask and answer your questions. You'll get downloadable files and PDFs and checklists so that it's really simple and streamlined. And then for the first 20 people that sign up, I'll be giving you website templates. And if you sign up today for the first, let's say 5 people, I'll be helping you create your simple website. And so that you really don't have to worry about the tech. I can help you with the tech. Kim can help you with the business. We want to get you started. That's what this course is about, is trying to, by any means, really make sure that you actually take the leap and start your practice in a really successful and also, simple way. We don't want you to be stressful. We're here for you to help you in whatever way possible. So like I said, if you sign up right now for the first 20 people, you get an extra $50 off. So it becomes only $647. And if you want to think about it, signups go till February 4th because we'll be starting on the 4th. and it's $697 otherwise. And hurry though, because this is like an initial offer. This course can easily be, and it really is worth thousands of dollars with all the bonuses and with all the time and effort we're putting in. So I will put the link right here too, so that you guys can hopefully see that. So if you want to just hit the buy now, it will take you directly to the page where you can purchase, and that buy now has the 50 off link already in it, so you don't have to worry about that. And I'll put also the code 50 off. That's the code. If you, oops, I think I put 500 off there. But that's the code.
No, it says 50.
Perfect. That's the code if you want to later put that in to get that extra 50 off. But that is, you can hit that buy now, and I will put the link right now for the page where you can go to read that all the sales and all that's included. Does anyone have any questions? Okay. Good. Well, I really hope we have, hopefully, taught you something in this webinar. And I really hope to see you in the course that Kim and myself are doing live. And I said, don't get intimidated by the live factor either, because the live course it's going to actually be so much more effective learning live. You'll get Kim throughout the webinar. You'll be able to ask any questions you want to. I'll be on there too, and we'll help you with both the business side and the tech side to get all of this up and running. Any last little bits you want to chime in, Kim? And if you have any questions, you can email me at I'll write it in, but alternativehealthcarecareers@gmail.com. And Kim is Kim@stretchphysicaltherapy.com. Or sorry, I put those in there. Okay.
I was just going up through a couple of questions here that I think we didn't answer. And I know there's a lot, and it will be covered in the course. I can assure you we've gone through every little bit. That's what I call it. My grandson calls it the clinic. So as far as aging in place, it's a huge opportunity for aging in place as far as seniors and how to keep them moving and mobile. And that's a lot of the stuff that we focus on. Again, my focus on seniors is not my Medicare clients, but mobility, of course. Post-therapy exercise practice. I know there's going to be I can help you with that. We do a lot at the clinic, and I've got systems in place for what that looks like for someone. And I think that's a caveat.
Definitely. I mean, basically, this course, and I know that it can be intimidating to sign up for a course, and I've signed up for several courses, and I've actually been really disappointed in the eventual results from a course. But that's why I can tell you, Kim is so experienced. You're getting 20 years of experience and 5 years of ownership experience, which you can't really compare to anything else. To try to start your own business, it would just be overwhelming. And so this is just worth the money in the fact that you're saving so much time, energy, and effort and stress to know that you're going to have an amazingly reputable business right off the bat. Angie asks, is it possible to be an independent consultant? What's your thoughts on that?
Angie wants to be an independent consultant to what? To a customer, or I'm trying to understand the question.
Yeah, maybe give us some more context for that one, Angie. But any questions about the course, you all can email us later on. And remember, first 20 people get that $50 off, plus first 5 people to sign up. I will be helping you with your websites. And, we really want to make this as streamlined and amazing as possible. She says, consultant as a coda. Well, you can do a travel coda. instead of going through a big.
Oh my gosh, that would be probably awesome. Consultant, you can be a consultant. You just want to look at what your niche is, and we talk about that in, I think it's chapter 2 when we talk about organizing your mission and vision, because there's a lot to think about. So you don't want to think about what your role looks like until you determine what your ultimate goal of the practice is going to be, because things kind of get a little crazy if you jump in and you say, I want to be a consultant, but you don't know what you're going to be doing as a consultant, if that makes any sense whatsoever. So absolutely, I'm not saying you can't be a consultant. You can. There's just some steps that you need to take and make sure that your T's are crossed and your I's are dotted so that you are a successful consultant.
Definitely. So that's pretty much it for the webinar. Unless anyone has any more questions, remember the link is alternativehealthcarecareers.com/boss. If you want to go and check out the course and think about it. And once again, you can email Kim at stretchphysicaltherapy.com, me at alternativehealthcarecareers@gmail.com. If you have any questions, we want to make sure that you feel really comfortable starting this course. And it really is going to be a complete, amazing experience. And I know that we're positive, and we, promise you that you will leave, if you follow our instructions, you'll leave with an amazing business that's ready to start right away, day one, and get you clients.
And we'll be with you, holding your hand and guiding you along the way. So don't think that we're going to throw stuff at you and just expect you to do it. We're going to be collaborative and help you be successful.
Yes,
that's the
exactly.
key.
That's really it. Is like, I want to work with someone and make sure that I'm providing an amazing experience in whatever I do. And that's what this is. Like, if anyone has worked with me, has spoken with me, you know that I'm extremely passionate, and I want to make sure that you're really happy, really comfortable with whatever you're doing. And so this course, we're going to be holding your hand and making sure you're accountable, and really making sure that you're confident and that you can do this. And so I'll be helping you on the website side, and Kim has got everything. She's got the website side too going on. Her website's great, stretchphysicaltherapy.com, if you want to take a look. But, we'll be helping you with literally everything, the start to finish. It's called the Boss course, but it's really should be like the complete course, because when I looked at this outline, I'm going, this is everything. Finally, the marketing, the business side, the implementation side, and you're getting Kim's formula for having people give you rave reviews, which is something that can be really tricky. Starting out, finding your niche and finding how to figure out how to be successful in the business. And, one of the things that Kim talked about was researching and understanding that tightness was really a sought after sort of keyword, or a sought after mobility challenge. And so I could even do some more webinars on that, and how to do keyword research to know what your niche should be, and how to target that certain population to know that, you're really trying to get high quality leads. So once again, that link is alternativehealthcarecareers.com/boss. And you can click that buy now to save $50, and it's first 20 people. And also remember, first 5 people, I'll be helping you with your website too. So I really hope you all take this opportunity, and we just really appreciate you coming on to the webinar and taking time to join us.
Yep. And if there's anybody that wasn't able to make this webinar, then we'll make this available through the recording as well. If you have any questions, again, reach out to either of us with your questions, and we're happy. If it's something I can't answer, then I'll make sure that you have Emma's contact information to get things over to her.
Yes, exactly. So look out for this, the replay. And once again, we're here, and don't wait too long to sign up, because we will be starting the live webinar trainings on the 4th. And so there's a countdown there. Okay. Thank you so much, everyone. We appreciate your time, and look out for the replay, and have a wonderful evening. Thank you.
Thanks, all.